If you or someone you love is managing type 2 diabetes or trying to prevent it, there's a good chance metformin has come up in a conversation with your doctor. And for good reason. Metformin is one of the most studied, most prescribed medications for blood sugar control in the world. Over 37 million Americans are currently living with type 2 diabetes, and millions more are in that gray zone, pre-diabetes, where the numbers aren't terrible yet, but the direction is worrying. Now, I want to be clear right from the start. I'm not here to tell you to throw your metformin away. That is not what this video is about. What I am here to talk about is something that most doctors, myself included, for a long time, don't spend nearly enough time on in a regular office visit. Because here's what the research is starting to show. Certain foods, whole, real, available at your grocery store foods, activate some of the exact same biological pathways that metformin targets. Not as powerfully, no, but consistently enough and with enough clinical evidence behind them that if you're over 60 and managing blood sugar, you really should know about them. Now, here's one thing I want you to keep in mind as we go through today's list. Blood sugar control isn't a one-size-fits-all problem, and it changes as you age. After 60, your body handles glucose differently than it did at 40. Your muscles become less responsive to insulin. Your pancreas takes a little longer to react after a meal. And your liver, which plays a huge role in how much glucose is in your bloodstream in the morning, starts to regulate that less precisely. These aren't things your doctor may have explained to you in detail, but they matter a lot for why these 4 foods work, and I'm going to make sure we connect the dots. And I'll tell you this right now. Food number 2 on today's list has been directly compared to metformin in a clinical trial, head-to-head, and the results were surprising in the best way. I'll get to that in a few minutes. But first, let's spend just a moment on exactly how metformin works, because once you understand that, you'll understand why these foods are so interesting. So, metformin, what does it actually do? In plain English, metformin has 2 main jobs in your body. First, it tells your liver to calm down. Your liver is constantly producing glucose, even when you're not eating. It's doing this around the clock. It's called gluconeogenesis. In people with type 2 diabetes or insulin resistance, the liver tends to overproduce glucose, especially overnight. That's why blood sugar is often highest in the morning, before you've eaten a single bite. Metformin slows that process down. Second, metformin improves how your muscles respond to insulin. Think of insulin as a key and your muscle cells as a lock. In insulin resistance, the lock is sticky. The key doesn't turn easily. Metformin helps oil that lock. Both of these effects happen largely through a molecule inside your cells called AMPK, adenosine monophosphate activated protein kinase. It sounds complicated, but here's the simple version. AMPK is like your body's energy sensor. When it's activated, it tells your cells to get more efficient, burn glucose, stop overproducing it, become more responsive. Here's why this matters for today's list. Several of the foods I'm about to show you activate AMPK. Some of them do it in ways that are remarkably similar to what metformin does, and that's not an accident. That's why researchers started studying them in the first place. Now, none of these foods are a prescription drug. They don't work as fast, and they're not a substitute for proper medical care. But for adults over 60 who want to support their blood sugar through diet, and for people who are experiencing side effects from metformin, understanding these options is genuinely valuable. All right, let's get into the list. Food number 1 is one that a lot of my Western patients have never heard of, but it's been used in traditional medicine across Asia, Africa, and the Caribbean for centuries. It's called bitter melon. You may also hear it called bitter gourd. And before you say, that doesn't sound appealing, stay with me, because the science behind this one is genuinely impressive. Bitter melon contains several active compounds. The most studied ones are polypeptide P, charantin, and visine. Now, here's what makes these compounds remarkable. Polypeptide P actually behaves similarly to insulin in the body. It can help signal cells to take up glucose from the bloodstream, which is, at its core, what insulin does. Charantin has been shown to reduce blood glucose by acting on liver and muscle tissue. And all three of these compounds together appear to activate that AMPK pathway I mentioned earlier, the same one metformin uses. Now here's the age-specific piece I want you to pay attention to. After 60, AMPK activity in your body naturally declines. This is one of the under-discussed reasons why blood sugar control becomes harder as we age. Your cellular energy sensor starts to lose sensitivity. It's not just about diet or willpower, it's biology. Research published in the Journal of Ethnopharmacology and subsequent clinical trials have looked at bitter melon in patients with type 2 diabetes. One study following patients over 3 months found meaningful reductions in HbA1c. That's your 3-month average blood sugar reading, the number your doctor looks at to gauge long-term control. The effect isn't as dramatic as a pharmaceutical dose of metformin, but it's real, it's measurable, and it's happening through the same biological channels. So how do you actually use bitter melon? The most common options are juice. About 50 to 100 milliliters of fresh bitter melon juice in the morning is a traditional preparation that's also been used in clinical studies. I'll be honest with you, it's bitter. That's not going away. But some people get used to it. Stir-fried, if you slice it thin and stir-fry it with garlic and a little salt, the bitterness mellows significantly. It's a staple in many Asian cuisines. Supplement capsules. If the taste is a hard no, bitter melon extract is available as a supplement. Look for standardized extracts with at least 10% charantin content. One important note, if you're currently on insulin or insulin-stimulating medications, bitter melon can enhance their effects. That means your blood sugar could drop lower than expected. Please let your doctor know you're adding this to your routine. It's a simple conversation that can prevent a problem. Food number 2, and this is the one I mentioned at the beginning, the one that has been directly compared to metformin in clinical trials. It's called berberine. Berberine is a bright yellow alkaloid compound found in several plants, golden seal, Oregon grape, barberry, and a plant called tree turmeric that's been used in Ayurvedic medicine for thousands of years. You're not going to eat a spoonful of Oregon grape for breakfast. But berberine is available as a concentrated supplement, and that's primarily how it's been studied. Let me tell you why this compound is so remarkable. Berberine is one of the most potent natural AMPK activators ever studied. When you take berberine, it enters your cells and does several things that are genuinely parallel to what metformin does. It inhibits gluconeogenesis in the liver. Remember, that's the liver's tendency to overproduce glucose. It improves insulin sensitivity in muscle tissue, and it does all of this through AMPK, the same pathway, the same mechanism. Now, the clinical trial comparison I promised you. A meta-analysis published in the journal Evidence-Based Complementary and Alternative Medicine reviewed 14 randomized controlled trials. The conclusion? Berberine produced equivalent reductions in HbA1c and fasting blood glucose when compared to standard oral diabetes medications, including metformin, in patients with type 2 diabetes. Let me say that again. Equivalent reductions, not promising preliminary data, not may help, equivalent results. And here's an angle that matters particularly for my patients over 60. One of the most common complaints I hear about metformin is gastrointestinal side effects: nausea, diarrhea, stomach cramping. This affects somewhere between 20 and 30% of people who take it, and it tends to be worse in older adults because the digestive system becomes more sensitive with age. In the studies that compared berberine to metformin, berberine produced fewer GI side effects, not zero, but significantly fewer. For older adults who struggle to tolerate metformin, that's a meaningful difference. There's also the B12 issue. Long-term metformin use is well documented to reduce B12 absorption, and B12 deficiency in older adults is already common and can cause nerve damage and cognitive decline. Berberine does not carry this same risk. Now, I want to be direct with you about something important. Berberine is a powerful compound. It can interact with other medications, particularly blood pressure drugs, cholesterol medications like statins, and blood thinners. If you are on multiple medications, and many of my patients over 60 are, please do not start berberine without reviewing it with your physician or pharmacist first. The typical dose used in research is 500 milligrams, 2 to 3 times per day, taken with meals. The with meals part matters. It helps reduce stomach upset and aligns the compound's action with when you actually need glucose control. This is the one food on today's list where I'd say the evidence is the strongest. It's serious enough to treat seriously. We're halfway through the list, and if you're finding this useful, hit that subscribe button right now. Every week we put out videos like this one, specifically designed for adults over 60. Next week we're going to talk about GLP-1. That's the hormone behind those weight loss drugs everyone's been hearing about, and which natural foods can stimulate it without a prescription. You don't want to miss that one. Now back to the list. Food number 3. This one you almost certainly already have in your kitchen. Cinnamon. Now, you might be thinking, cinnamon? Really? That's not exactly a dramatic revelation. But give me 2 minutes here, because most people don't understand why cinnamon works, or which cinnamon matters, or how much makes a difference. And those details separate people who get results from people who don't. The active compounds in cinnamon, particularly cinnamaldehyde and a group of polyphenols called type A polymers, work on blood sugar through a different mechanism than anything else on today's list. Instead of going after the liver, they work primarily on your muscle cells. Here's what they do. They increase the activity of a glucose transporter called GLUT4. GLUT4 is essentially a door on your muscle cell membrane that glucose has to pass through to get inside the cell and out of your bloodstream. In people with insulin resistance, those GLUT4 doors don't open as readily. They need a stronger insulin signal to respond. Cinnamon's compounds help those doors open more efficiently. And here's why this is particularly relevant for people over 60. As we age, we lose muscle mass. This is called sarcopenia, and it's almost universal after 60 if you're not actively working to prevent it. Less muscle mass means fewer GLUT4 transporters overall, less surface area for glucose to enter cells. This is one of the biological reasons why blood sugar management genuinely gets harder with age. It's not all lifestyle. Some of it is structural. Cinnamon can't replace lost muscle, but it can help the muscle you have work more efficiently in terms of glucose uptake. What does the research say? Multiple randomized controlled trials have shown that cinnamon supplementation in doses of 1 to 3 grams per day reduces fasting blood glucose, improves insulin sensitivity, and in some studies reduces triglyceride levels as well. One study in diabetes care showed meaningful reductions in HbA1c over 40 days in type 2 diabetic patients. Now, the critical detail. Not all cinnamon is the same. There are 2 main types you'll find in the United States: Ceylon cinnamon, sometimes called true cinnamon, is lighter in color, slightly milder in flavor, and lower in a compound called coumarin. Cassia cinnamon, which is what you'll find in most American grocery stores, the standard brown powder in the spice aisle, contains much higher levels of coumarin. At low doses, that's fine, but at the amounts needed for blood sugar benefit, 1 to 2 grams a day, consistently, cassia cinnamon's coumarin content can stress the liver over time, particularly in older adults whose liver function is already less robust than it once was. My recommendation: if you're using cinnamon specifically for blood sugar support, look for Ceylon cinnamon. It's available at health food stores, online, and increasingly at mainstream grocery stores. Check the label, it will say Ceylon or Cinnamomum verum in the ingredients. Practical ways to use it: half a teaspoon to 1 teaspoon in your morning oatmeal, mixed into Greek yogurt, stirred into your coffee, or added to a smoothie. Simple, easy. And if you're using Ceylon, completely safe for daily use. And our final food for today. This one is less well known in Western kitchens, but it's been used medicinally for thousands of years across the Middle East and South Asia, and modern research has given us some very clear explanations for why it works. Fenugreek, specifically fenugreek seeds. Fenugreek seeds work through 2 distinct pathways, and together they make it a uniquely effective food for blood sugar management in older adults. Pathway number 1, fiber-based glucose slowing. Fenugreek seeds are extraordinarily rich in a type of soluble fiber called galactomannan. This fiber forms a thick, gel-like substance in your digestive tract when it absorbs water. And that gel does something important. It physically slows down how quickly carbohydrates are broken down and absorbed in your intestine. Think of it this way: when you eat a meal without fenugreek, the carbohydrates from that meal enter your bloodstream relatively quickly, causing that spike in blood sugar. With fenugreek's fiber present, it's as if the gate on your intestinal wall has become much narrower. The glucose still gets in, but it gets in slowly over a longer period of time. That means a gentler rise, a lower peak, less stress on the pancreas, less insulin demand. Pathway number 2, direct insulin stimulation. Fenugreek contains an unusual amino acid called 4-hydroxyisoleucine. You won't find this anywhere else in the plant kingdom at significant concentrations. What does it do? It directly stimulates the beta cells in your pancreas to produce and release insulin, but specifically in response to elevated blood glucose. It's what we call a glucose-dependent insulin secretagogue. In plain terms, it tells your pancreas to respond more quickly and more appropriately when blood sugar rises. Now, why does this matter especially after 60? One of the key changes in glucose metabolism with aging is what's called delayed first-phase insulin response. When a younger person eats a meal, their pancreas responds almost immediately, within minutes, to release insulin and start pulling glucose out of the bloodstream. After 60, that first phase response slows down. The pancreas reacts, but later. And in those extra minutes, blood sugar has already climbed higher than it should. This is a major reason why postprandial glucose, blood sugar after eating, tends to be more problematic in older adults, even when fasting glucose is reasonably controlled. Fenugreek addresses both sides of this problem. It slows how fast glucose enters the blood, and it nudges the pancreas to respond faster. That's a meaningful combination. Research has consistently supported this. Studies show that 10 to 15 grams of fenugreek seed powder per day taken with meals can reduce HbA1c, lower fasting blood glucose, and meaningfully reduce postprandial glucose spikes over 8 to 12 weeks. One Indian clinical trial found HbA1c reductions comparable to adding a low-dose oral medication. Practical guidance. The easiest way to use fenugreek is the seed powder, 1 teaspoon to 1 tablespoon mixed into a meal. It has a slightly bitter, maple syrup adjacent smell that some people find pleasant and some find strong. Soaking the seeds overnight significantly reduces bitterness if you prefer the whole seeds. You can mix the powder into yogurt, add it to soups, incorporate it into bread or flatbread if you bake, or find it encapsulated as a supplement. One important caution. Fenugreek can enhance the effects of blood-thinning medications, warfarin in particular. If you're on a blood thinner, please have a conversation with your doctor before adding fenugreek regularly. Alright, let's take a step back and look at what we have. 4 foods, 4 different mechanisms. Bitter melon activates AMPK and mimics insulin signaling, similar to metformin's core mechanism. Berberine also activates AMPK while suppressing the liver's overproduction of glucose and has head-to-head clinical evidence against metformin. Cinnamon improves GLUT4 function in your muscle cells, helping glucose get absorbed more efficiently, which matters more as muscle mass declines with age. Fenugreek slows carbohydrate absorption in the gut and prompts faster insulin release from the pancreas, directly targeting the postprandial spike problem that gets worse after 60. Notice that no single medication, including metformin, hits all 4 of these pathways simultaneously. Metformin is primarily a liver and AMPK drug. It doesn't do much for GLUT4 function or for slowing intestinal carbohydrate absorption. These foods, used thoughtfully, can fill in gaps that pharmaceuticals don't address. Now, I'm not telling you to try all 4 of these at once. That would be overwhelming, and honestly, it would also make it impossible to know what's working. My suggestion, if you want to explore any of these, is to start with one. Pick the one that feels most accessible to you. Maybe that's cinnamon because it's already in your kitchen. Maybe it's fenugreek because the research on postprandial glucose resonates with your experience. Maybe you're interested in berberine because of its clinical track record. Add one thing, give it 6 to 8 weeks. Have your doctor check your blood sugar numbers. And please, especially if you are currently on metformin, insulin, or any other blood sugar medication, keep your doctor in the loop. Some of these compounds are powerful enough to meaningfully lower blood sugar, which sounds like a good thing, and it is, unless it's happening in combination with medication and nobody is monitoring it. That's when blood sugar can drop too low, and hypoglycemia is something we take seriously. This is information that empowers you to have a better conversation with your doctor, not information that lets you skip the conversation entirely. So let's do a quick recap. 4 foods that work through some of the same biological pathways as metformin. 1. Bitter melon. Mimics insulin, activates AMPK, particularly relevant for seniors because AMPK activity naturally declines with age. 2. Berberine. The most clinically studied of the 4. AMPK activation, liver glucose suppression with less GI irritation than metformin in comparative trials. 3. Cinnamon. Improves GLUT4 function in muscle cells, helping your body absorb glucose more efficiently. Use Ceylon, not cassia, for daily supplementation. 4. Fenugreek. Slows carbohydrate absorption through soluble fiber and stimulates faster pancreatic insulin response, directly targeting the postprandial glucose problem that becomes more common after 60. I want to hear from you. Of these 4, which one are you most interested in trying? Leave it in the comments below. I read them and I'm genuinely curious which ones resonate with this community. And if you found today's video valuable, please share it with someone who's managing blood sugar, a spouse, a sibling, a friend. This kind of information should be reaching more people. Next week, we're going to talk about GLP-1, the hormone that drugs like Ozempic mimic, and the natural foods that may stimulate it. It's one of the most important conversations happening in metabolic health right now, and we're going to break it down in a way that's actually useful for adults over 60. I'm Dr. Leonid Kim. Take good care of yourselves, and I'll see you in the next one.